Hello, my name is Nhat Nguyen, and I'm currently a part of the CIMI 2017 program. I'm working in Dr. Madhavan's lab on the complications of Parkinson's disease. My opening question is, how do we find the missing pieces of the mysterious Parkinson's disease puzzle that has been bothering many scientists for decades about its causes, symptoms, and treatments? So, what is Parkinson's disease?
Parkinson's disease, or PD, is a progressive neurodegenerative disorder that affects more than 10 million people worldwide, and the number will continue to grow exponentially over time.
How do we know if someone has PD? PD signs and symptoms vary from one person to another. If one starts to show these signs and symptoms, diagnosis from the doctor may be necessary.
Here are the few signs and symptoms. Olfactory dysfunction, which affects one's normal sense of smell, tremor, or shaking, begins in the limb, typically the hands or the fingers. Rigidity, gait dysfunction, loss of balance, swallowing and speech difficulties, and cognitive impairment.
Overall, age is the best predictor of PD. Most cases of PD occur at the age of 65 and up. Is there any treatment for PD?
The average medication cost for one patient who is suffering from PD is about $2,500 per year, and a therapeutic surgery may cost around $100,000. The patient's doctor can prescribe a variety of medications to help the patient battle against PD, such as dopamine promoter, antidepressant, anti-tremor, etc. Studies show that medical herbs such as green tea, black tea, turmeric, velvet bean, and many others exhibit potentials in battling against PD by providing antioxidative, anti-inflammatory, and neuroprotective properties.
So, where do we stand today on the issues of PD?
There are numerous researches on PD about its causes, both motor and non-motor symptoms, and possible treatment through experiment on human and animals' neural cells. However, more studies are needed to fully understand the mechanism of PD.
In our lab as a whole, we are researching on the characteristics of neural stem cells as well as their unique abilities to differentiate into three different types of neural cells such as astrocyte, neuron, and oligodendrocyte. By using the information we've gathered about neural stem cells, we can develop therapeutic approaches to neurodegenerative disorders such as Parkinson's disease. I, as an individual, am working on characterizing different types of cells such as motor neuron, sensory neuron, and dopaminergic neurons by counting the subpopulation of cells and analyze the percentage of neural cells between a person with and without Parkinson's disease and also other neurological diseases. Lastly, the questions are, can treatments for PD somehow applicable to other progressive neurodegenerative disorders such as Alzheimer's disease? By the time the doctors diagnose the patient with PD, 60 to 80% of his or her dopaminergic neurons were already lost. So how do we detect the signs and symptoms of PD sooner so we can increase our chances in treating the patient with PD? If there's a known cause for PD, then how do we find a cure that is affordable for patients with PD in the future?